To Eddie Crouch, chair of the British Dental Association. A story came across our desk yesterday suggested that inmates in prison are actually getting better dental service than anybody outside of prison. And this includes murderers, rapists. You get more chance of an appointment, apparently, than anybody wandering around the streets. Eddie, very good morning to you. Is this true?
It is true. Obviously, it's not a great service in prison. It's mainly emergency service that's being provided. But if you've got a problem, you're likely to be seen in prison. And sadly, it's not the same on the high street. We have a massive problem with about 13 million people struggling to gain access to an NHS dentist.
Well, the piece in the Telegraph quite helpfully gives some statistics. It says the number of people in the general public who have access to an NHS dentist, 52%. Prisoners, 100%. The minimum cost of a checkup, £26.80 to you and I. For a prisoner, zero. The cost of a filling, £73.50 to a prisoner, zero. Cost of dentures, £319.10 to us. To them, absolutely nothing.
Yeah, I mean, obviously when you're in prison, all the charges are exempt from charges.
But prisoners get paid for being in prison, don't they? Because, I mean, when we saw prisoners coming out of prison, I remember asking the question to a prison officer, how come they're coming out with all these bags? And he said, well, they're allowed to, to buy things when they're in prison because they do have money which they accrue for either doing particular jobs or just for being there. So why can't they pay for their own teeth?
Well, I'm not sure. I don't know how those arrangements were actually brought into place in the first place. But, I mean, they're not getting a comprehensive dental service in prison. But sadly, some people on the high street are having to do that.
Yeah, neither for the rest of us. I mean, there are some people in this country who, like I say, 48% have no access to an NHS dentist.
Yeah, it's shocking.
It is.
And the government made a pledge in the general election campaign to deliver 700,000 extra appointments. It's a drop in the ocean, really, in comparison to 13 million people who need the treatment, who want it. But, we're 4 months into the regime at the moment, and we've got no sign of these 700,000 appointments being delivered.
No, exactly right. And what have you heard from Wes Streeting? Because, I mean, he keeps saying he's giving more money to the NHS. Is any money trickling down into the dental services?
Well, there was no mention of dentistry at all in the budget. And, in fact, colleagues on the high street are really more worried now after the budget than they were before, because the national insurance contributions, the minimum wage things, will affect high street dental practices. Many NHS practices that are struggling to make a profit are going to be losing about £14,000 to £16,000 a year with those changes unless they're compensated.
Yeah. I mean, it's a shocking state of affairs, isn't it? So, I mean, are you making, or is the British Dental Association, I should say, making kind of any representations to Wes Streeting or his department?
Well, Stephen Kinnock is the minister responsible for dentistry, and I met him on Monday. Okay. We'd heard that they'd allocated 125 million before the general election to cover these 700,000 appointments, and we now understand that these 700,000 appointments are going to be covered from existing budget that's been underspent. So it's no new money at the moment.
Right.
I understand
which budget has been underspent in the health service then?
Well, dentistry, sadly, last year had an underspend of about £500 million.
And why is that?
Because no one wants to actually work in the current contract. People can't recruit dentists into their practices to deliver NHS care. And so if they don't deliver it by the end of the year, they hand the money back to the NHS. And last year it was at record levels.
That's extraordinary. And did he give any indication at all as to whether he would up the contribution to dentists so that more of them will come into the NHS?
Well, what he said was that the funding allocation for next year, when these national insurance charges and minimum wage come into effect, will be looked at by the Doctors and Dentists Review Body. But we're still waiting for the uplift from the previous Doctors and Dentists Review Body. That should have been in April. Here we are now in November, and my colleagues on the high street still haven't seen an uplift in their contracts.
Extraordinary. Eddie, good to talk to you. Thanks very much indeed. Eddie Crouch, chair of the British Dental Association.